Tonight, NADMO stretched to breaking point as it struggles to settle more than 20,000 residents displaced by spillage of Akosombo Dam that has left a trail of devastation in communities in at least 3 regions.
We have close to 20,000 completely displaced who are staying with friends and family as we speak.
What is the plan for those people?
That's what we are working on, and that is the critical challenge. So most of the complaints you hear are the complaints from those who are living with friends and family.
We are live on the ground in Mepe in the Volta region where President Akufo-Addo has just touched down.
It is to come and sympathize and commiserate with you about the tragedy that has occurred. And the coordination is about immediate, about tomorrow, and about tomorrow. The most important thing was, first of all, to ensure the life of people.
Plus, we tell you what the president has been saying about the tragedy being an avenue to campaign for votes.
But that is not my concern. And in any event, one day you will vote for me and my party.
This is Top Story with Evans Mensah.
And Top Story is always brought to you by Vodafone. The full picture of the devastation caused by the spillage of the Akosombo Dam is beginning to come to light tonight as President Akufo-Addo touched down less than an hour ago to assess the sheer scale of the destruction. The National Disaster Management Organization, NADMO, says so far as many as 26,000 people have been displaced. 20,000 of this number are yet to be resettled. Residents, including thousands of women and children in 9 districts across the Volta, Eastern and Greater Accra regions, have had their homes and livelihoods swept away by the floods from the spillage of the Akosombo and Pond dams in the last 5 days. We'll take you live shortly to the Volta region where the president just touched down. But first, let's get a sense of the extent of the problem from NADMO. The Deputy Director General at NADMO, Seji, has been speaking to Joy News after the assessment.
We have safe havens only in North Town and Central Town. As for South Town, all the people affected in the communities have moved to stay with their relatives and friends. We have close to 2,500, 600 at Central Town. We have more than 3,000 people in North Town. North Town has about 9 safe havens. And Central Town, they are currently having 3 safe havens. But in both North Town and Central Town, they also displaced people who are living with friends and families too as well in other communities.
So all put together, all the 3 hardest hit districts, what are the numbers?
Well, we've recorded over 9,000 for North Town, over 6,000 for Central Town, close to 4,000 for South Town. But in all the 8 districts, including Shai, Osudoku, Esujaman, Adan, we are getting close to 26,000 as we speak. And we are still getting more people. We do a review of the figures normally in the evening into the next day.
Out of this 26,000, what percentage do you have placed in these safe havens?
Okay, we have currently more than 6,000 in safe havens across all the districts because Adan has also started receiving people into their safe havens. Shai Usudoku has close to 700 people also in their safe haven.
Which means about 20,000 are out there and not in any of these safe havens.
Exactly. We have close to 20,000 completely displaced who are staying with friends and family as we speak.
What is the plan for those people?
That's what we are working on, and that is the critical challenge. So most of the complaints you hear are the complaints from those who are living with friends and family. We are trying to work through the assembly system, the assemblymen, the NADMO zonal coordinators to try and reach them with some relief items.
Well, it is no surprise that many of the affected are still without relief.
No, please. We only get drinking water here, but food stuff there, we haven't getting some yet.
No, but the National Disaster Management Authority has been sharing some relief items to affected residents. Yeah. I mean, how come you don't have some?
I can't. It's just that we don't get some. If you go to the other side, they are sharing some there right now, but we are not benefiting here. We don't benefit here.
Why are you not going there to collect yours?
They say unless they write your name, and they are not coming here to write our name here. So we don't know what is going on.
So since about 3 days now we are here, we not getting anything. Only water. Then our friend Big get to give us to us. So it's just water that we get.
Who is giving the water?
Afako, Mr. Afako.
So are you telling us that you've not received anything from NADMO?
No, we not have anything
like that.
Madam, tell us. You said nothing. Why?
We went to Kizito over there. They say only those sleeping over there that they are sharing their things for. So they will bring these people their own later, but we haven't get anything yet.
For how many days now?
For 2 days now. We came here, that was Saturday. So today we haven't received anything now.
But before then, did you receive anything from NADMO?
Nothing.
Well, these residents are now bracing for more pain ahead. The Volta River Authority says they will be spilling more water from the dam to avoid a catastrophic breach of the dam itself. Listen to the Deputy Chief Executive Officer of VRA in charge of engineering and operations, Edward Kenzo.
3 days ago, it was around 386,000. It drops to 340 as of yesterday, and today is around 286,000 cubic feet. So at least the water is dropping. 3 days ago, the rise in the lake level was about 0.14. 2 days ago, it was about 0.12. Yesterday, it was 0.1, and today is 0.05. So at least we can see that the rate of rise of the dam is also receding. Per our data collected, we know from the middle of October to the end of October, the volume of water that comes into the dam also recedes. So if this is going to continue, then we know that at least we are getting out of the difficult situation of catching up with the level in the dam and the amount of water that should be evacuated. We are still maintaining the amount of water that we are evacuated since 10th October, which is the 183,000 cubic feet.
Why so if the dam, the inflow is reducing?
Okay. The height today, as the operational level in the water of the dam should be 176 feet operational. The maximum allowable operational level is 177.5. And today is 177.29 this morning. This afternoon, it has gone to, as at 2 o'clock, it has gone to 177.32. So from what I said, we are left with only 8.18 for us to get to the maximum allowable operational level of the dam. So if I stop the volume that I'm spilling, then the rise will be rapid, which means I'm going to topple the dam. The integrity of the dam will be at play that we don't want to. So if I'm spilling 183 and I'm still getting a bit of rise, there should be a concern to me. So to me, the best option is either to increase, but if I increase, the effect down there will be so great. So we are balancing the act to make sure that at least we stay where we are and make sure that at least we get to a point that we get negative rise, then we can start closing the dam. But per our projection, we know that maybe get to the end of October, we'll be approaching those points and maybe take other decisions going on.
So based on the figures you are, seeing, where are we likely to see the closure of the floodgates? When are we likely, projection?
By the end of October, we should start seeing something. If things should be as it is, if nothing unusual happens with some heavy rains into the dam, then we are looking at end of October per our projection.
Which means that we'll still be spilling from now to end of
same volume will continue. Hopefully we are not going to increase the volumes. The same volume will continue.
So same volume continuing, meaning more pain for those already affected. There is also now the real fear of a public health crisis as affected residents struggle for clean water and general sanitary conditions. The Ghana Medical Association is stepping in tonight, dispatching doctors to assist. Dr. Frank Srebro is president of the GMA.
What we have decided to do is that we are sending doctors to the affected areas. In fact, tomorrow the team will move. And we are just going to try and at least give the basic medical support that we can give. We recognize the fact that there are children whose immunizations are probably due, they need those immunizations. We know that there are adults who are hypertensive diabetics, and of course those who have other ailments that we need to attend to. And with this kind of spillage and the overflowing of the water and the floods that is causing, we are anticipating some diarrhea diseases and, of course, even the likely outbreak of cholera. So we have actually earmarked some funds to be able to secure some drugs, and we are also putting boots on the ground by sending personnel to affected areas to try and offer the little help that we can.
Just had the MP for North Tongue talk about some displaced health officials. Is there anything the Medical Association is also doing to help them?
Precisely. In fact, our team is already on the ground on that issue. There is even a facility that they needed to even evacuate the whole facility, and the whole mortuary was also flooded. So it means that bodies had to be moved to sister facilities. There are health centers that are now underwater. It means that they cannot operate. So what we are trying to do is to actually get them to join other facilities which are operational along those areas so that at least they can increase the manpower to be able to attend to the people who are there.
Well, in the last hour, the president, the commander-in-chief of the Ghana Armed Forces, has himself touched down in Mepe and the Volta region. Already we know that the armed forces have already been deployed. We'll bring you the details of what they've been doing on Newsnight at 6. But the president today, when he touched down, briefing the chiefs and people there, assured that more relief will come.
My visit here today is a very simple one. It is to come and sympathize and commiserate with you about the tragedy that has occurred. When it happened, I was in America on official business. When the chief of staff called me in America about what had happened, and we discussed what had to be done. So that's when we agreed to establish an interministerial committee to coordinate government response to this tragedy. And the coordination is about immediate, about tomorrow, and about tomorrow. The most important thing was, first of all, to ensure the life of people. And that is why 9 centers were established here in Mepe for all the displaced people. And the people, all the people in these 9 centers have been provided relief items by NADMO. And it's NADMO's intention to continue the exercise of providing relief items.
Live now to Mepe, where my colleague Carlos Caloni is joining us right now. And Carlos, what has been the reaction to the president's assurance that more relief is on the way?
All right, Evans, they actually received the president's message with a lot of excitement. And indeed, the traditional leaders also have been expressing their appreciation to the president for his assurances to provide relief items to them.
And by the way, the president has also been talking about the farmlands that have been destroyed and what government's plan is going forward.
Yes, indeed. The president has been saying that the Ministry of Finance, the Ministry of Food and Agriculture, as well as his office, will team up to actually fashion out a comprehensive solution, to deal with the challenges of the affected persons in the 9 affected districts.
I'm aware that you are farming people. The people who are farming on the banks of the rivers. River banks that have overflown and destroyed many of the farms. So one of the things that the Ministry of Agriculture, the Ministry of Finance, and the Office of the President is going to be working with the district assembly is to decide exactly the nature of the support we have to give to you when the water has gone away, to enable you to do the following.
I have a Minister of Finance, Minister of Agri, President of Office, Wajadudu Gome, Benjamin Chie, Kejola, Nukamia Wakopere, Agredelau, Pre Akpailau.
That's why I'm saying that the committee is working in several phases. One, immediate relief.
The committee in several phase beton.
And then tomorrow. But I want you to know that the government is going to do everything in its powers to assist, to make sure that things are
you have there.
I think everybody here, and I hope you take the message all across, North Tongu, South Tongu, Central Tongu.
And Carlos, talking about relief and help from the central government, the president, as you heard him earlier, explain that those who have been taken to these 6 shelters have all been receiving relief items. But you also established from NADMO that there are even more than 20,000 people who did not get an opportunity to be settled in these areas, who are, in effect, on their own. Do you have any sense of how they are fending for themselves?
All right, so that was a question I posed to the Deputy Director General of the NADMO, Seji Saji, and he said that, well, they have established a registry where they are trying to reach these people, and then they can extend some of these relief items to them. And so it's not like they are leaving them out of the equation, but of course, when the flood waters came, they had to find their own way out. But then the NADMO as well as the District Assembly is teaming up to reach these people with the relief items.
And Carlos, what is this key thing we're also hearing tonight about the president talking about politics and votes?
Indeed, the president actually made a point that he is very much aware that people of Northtown did not vote for him, much, but he came here as the leader of the nation to sympathize with them. And so he now threw a word of caution to Ghanaians not to use some of these disasters we see as political, time to make politics. So he cautioned to desist from politicizing some of these things.
When these things happen and government acts, politics does not come into the matter at all.
Politics me here me crowd. I'm back way.
When I took the oath of office as president, I took the oath of office as president of every single individual in Ghana. Of all peoples in Ghana, all districts. And whether they voted for me or not, once I have taken the oath, I am the president of all the people. So, Toby, you and your elders, I want the people here, you, beginning with you and the elders, to understand that when something like this happens and government acts, government is acting for Ghanaians, all Ghanaians. I came here because Ghanaians are having difficulties and are suffering. And it is my responsibility to try and help. Because if it's a question of counting who votes for me and who doesn't vote for me, I shouldn't be here because you don't vote for me. But that is not my concern. And in any event, one day you will vote for me and my party. So Tommy, I came here this afternoon to express my sympathies and to commiserate with all the people of Mepe and the area.
And Carlos, I'm curious about this. What has been the reaction to what we just heard from the president? Hello, Carlos. We may not have Carlos on the line, but I have Dr. Senanu Kwesi Jokoto, who is joining us right now on the telephone. He's the Volta Regional Director of the Health Services. Doc, thanks for your time here on Top Story.
Thank you very much, Evans. A very good evening to all your listeners. Let me just make the quick correction. I'm the Deputy Director, Public Health.
Okay, thank you very much.
Health Service, Volta Region.
And give us a sense of the health situation in the region now, considering what the residents have been dealing with the floods.
Thank you very much. We've had the opportunity of doing the risk assessment in the three most affected districts in the Volta region. That's North Tongue, Central Tongue, and South Tongue. We have a sense of the number who have been displaced. Over 20,000 affected, but 12,000 displaced. Our health workers affected, close to about 100 people. One big facility has been shut down. That is the Richard Novarti Hospital that is in Sugakopa. We are also aware of the determinants of health, which includes good water, potable water, which has been denied the displaced populations. So there are several arms of this response. But for health, we have activated our coordination mechanisms, public health emergency management committees in all the districts and in the region, our rapid response teams, as well as our emergency operations center. First of all, we are ensuring that everybody is safe. We are doing the appropriate health education so that people conform to the right behavior. We are also ensuring that essential health service delivery is not interrupted. So for this displaced population, we have fashioned out a program to make sure that we reach them 24 hours so that they can access good health care behavior. Now, we are also aware that there are some diseases that are related to flooded communities, mostly diarrheal diseases, but other diseases like malaria, because people are exposed to the vagaries of the weather. So we want to avoid them as much as possible. So, for instance, mosquito nets are going to people as an intervention. We are working with others to ensure that good drinking water gets to the people. And then we are doing our disease surveillance. These diseases like typhoid fever, E. coli infections, salmonella infections, and cholera. We are doing an enhanced surveillance. So our community-based surveillance volunteers, health facility, disease, focal persons, everybody has been put on high alert so that we'll be able to identify such conditions and nip it in the bud. We are also looking at case management, making sure that we mobilize enough test kits, we mobilize enough medications, intravenous fluids, anything that will be required to respond to any such emergency. So from preparedness to mitigation to response to recovery, we are looking at it holistically so that the people who have been affected would be safe and sound.
Safe to say that so far your surveillance haven't picked up anything yet that shows that there may have been an outbreak already or an outbreak is in the offing?
No, we have established that there's no outbreak at this point. We have analyzed our data over the past 5 years. We are monitoring the situation to detect any variants that will suggest that there could be an outbreak so that we respond appropriately. But that doesn't prevent us from putting in the preventive intervention so that people actually don't even get sick.
You also said that the public health emergency protocols have now been activated. Are you treating this as a public health emergency?
Sorry, I didn't get.
Are you treating this as a public health emergency, considering that you've activated
a public health? Yes, it's a public health emergency. Yeah, so we've activated all our emergency mechanisms.
Are you adequately resourced for this challenge?
We are at the moment good enough to go, but we know that this is a very fluid situation. So we have put together contingency plans, and we are mobilizing resources to be able to go the long haul.
So you're mobilizing resources. What more do you require?
We require more funds to do more trainings, to settle our health workers, to be able to also ensure that we establish the appropriate contingency plans in hospitals like the South Tom District Hospital, Adidome Hospital, the Bakau Catholic Hospital as well. We need to take outreach services to those who have been displaced. That will also require some funding. We need more logistics, medicines, non-medicine consumables. All of these things are things that we've captured in our contingency plan. And like I said, we are mobilizing internally and externally as well to ensure that we are adequately equipped to respond to this disaster.
And you said earlier that about 100 of the health workers have also been affected by the floods.
Yes, that's accurate.
That means...
In Richard Novati Hospital alone, the entire stretch of accommodation for the health workers have been taken up by the flood, up to knee level and sometimes beyond. 51 people have been affected over there. And then when you go to the peripheral facilities where we offer essential health services as well, those places have been flooded. So the health workers have been moved to safe havens so that, first of all, they will be safe. We put them in the right psychological mindset, and then they can continue to offer the service to the people.
So you've managed to deploy these 100 already, although they are affected, they are still working?
We are in the process of settling them. Some have settled. We are yet to settle some of them yet. And then from there, they are going to beef up some of the facilities where we need support because of the pressure that would come from the closure of some of the facilities.
And what that means is that you definitely also will need more bodies, more health professionals joining you there to help you fully implement your emergency protocols, nurses, doctors. We heard tonight that the GMA is providing some assistance. You definitely will need more, I guess.
Yes, we are extremely grateful to the Ghana Medical Association, the GRNA, RNMA, and all other bodies who have so far mobilized to come and support. We definitely need everybody's support.
Thank you very much for that quick update there. And that is the Dr. Senanu Kwesi Jokoto is the Deputy Regional Director of Health there, giving us a sense of the picture when it comes to the health situation on the ground. Tonight is a major emergency there. He just heard him say that this for them is a public health emergency, and they are on high alert tonight, having deployed all they have and activated their emergency protocols. The President himself is on the ground tonight, treating this as a tragedy. He's described it as, and promising more relief on its way. Abla Jifa Gomashi is MP for K2 South, one of the constituencies affected by this, also joins us on the telephone line right now. Abla, thanks for your time here on Top Story. Give me a sense of where you are tonight with relief and resettlement for the people in your constituency affected.
Good evening, Evans, and thank you for the opportunity. I have nothing positive to say about relief, and neither do I know what the status is, if we are even included in all this discussion on the flooding of our communities. Yesterday, I spoke with a colleague, MP for True East, that's in the Bulo East, and they are also not been involved so far in the names being mentioned as communities affected by the flooding. So my understanding is that everybody is working on the communities surrounding Sogakopa, South Town, North Town, and Central Town. But Kata, Angro, Kata South, True East, and the communities before Akosombo, we are not mentioned in the conversation. So I do not know if the plan so far includes us.
And that's have you raised this? So the president himself is on the ground tonight. Have you had an opportunity to raise it with your authorities, and have you been given any feedback on when you get the relief for your people?
Well, we've been asking for relief since 2021, so I don't know what else to do. I've written, I've asked questions on the floor, I've spoken to the regional minister, the minister for Works and Housing in the past, and nothing was done. So really, this currently, with the lagoons being flooded because of this situation that we have, I have not really appealed to His Excellency directly or through his ministers. I've only spoken to the municipal chief executive of Kata South and appealed to him to see what he can do through the office of the president and the ministers to see what they can give us. Immediately, I think that people are getting foot rot and so on from walking through the water because it's got all kinds of health implications. And our sanitation is nothing to write home about. So I'm sure you can imagine why they are getting this foot rot. So we would need Wellington boots and some food and temporary shelter, which I've been asking for so long, and we still don't have it. So I think we're just where we were since 2021.
Thank you very much. And that, by the way, is Ablaji Fagomashide, MP for K2 South. The presidency and the government has set up an emergency fund that they are asking contributions into to assist the people in the Volta region affected by this news night. Starts right now.